Hi, everyone, and welcome to the 3D Digital Mammography Machine Virtual Donor Appreciation Celebration. I'm Allison Johnson, Manager of Communications at Windsor Regional Hospital, and happy to be your host today as we celebrate this new state-of-the-art technology that patients in Windsor, Essex now have access to. And that is thanks in large part to many of you who are joining us today and the contributions that you have made. About 2 years ago, Windsor Regional Hospital identified a need. The mammography equipment that we use to diagnose and rule out breast cancer needed a bit of an update. And there was a new technology out there that could take the service that we were currently offering and take it to the next level. This 3D technology is something that didn't exist in our community at the time, and the price tag was $500,000. Many of you know that this is not something that the province is going to cover, so our team in the foundation set out to start raising money. And thanks to your support, we were able to hit that goal and bring this technology to Windsor, Essex. Something that everyone who's joining us today should be proud of. And I want to recognize some members of our foundation who led this campaign. Please join me in welcoming Giselle Segan, Director of Philanthropy for the Windsor Regional Hospital Foundation, and Christina Nacarado, Manager of Philanthropy. Hi, ladies. Thanks for being with us today, and thanks for organizing this event. And we're going to hear more from Giselle and Christina a little bit later in the program. But right now, it is my pleasure to introduce Beth Ann Prince. She is president of the Windsor Regional Hospital Foundation Board of Directors, and she is going to kick off today's presentation. Beth Ann, over to you.
Hi, Allison. Thank you very much. Today is a very special day. October is Breast Cancer Awareness Month in both the US and Canada. It is fitting that we are going to talk about a piece of equipment that will help us prevent and detect breast cancer. Today, we are celebrating giving. This is our opportunity to say thank you and to recognize the very generous gifts that have been made in the installation of the first 3D digital mammography machine at Windsor Regional Hospital's Breast Health Center possible. Over the last 5 years, Windsor Regional Hospital performed over 85,000 breast exams. For the majority of women, it is a routine test to rule out cancer. In April of this year, the new 3D machine was installed, staff were trained, and tests started. To date, approximately 2,000 mammographies have been performed with this new machine, all because of you. We are excited because in a few minutes, Dr. Del Danano will be showing us this machine up close and personal. We were faced with this daunting task of raising $500,000 to support this purchase, and I am proud to say, with your help, we achieved this goal. A special shout out to Windsor Regional volunteer Carol Parent, whose passion truly ignited this campaign, and we are indeed grateful. So enjoy the next few minutes as we virtually show you the new 3D digital mammography machine in our Breast Health Center and celebrate our community's generosity. Once again, thank you for your continued support of the Windsor Regional Hospital Foundation. Now over to you, Allison, who is joined by Dr. Del Danano in the Breast Health Center.
And we're here now in the Breast Health Center with Dr. Del Danano and the 3D digital mammography machine that we're talking about today and that many of you have helped support. And Dr. Danano, I want to ask you, how significant is this machine for patients in Windsor, Essex?
Yeah, well, thanks for asking. It's very significant. This is an excellent advancement in the patient care that we're providing our patients in Windsor in terms of detecting breast cancer. One of the major revolutionary pieces with this new imaging technology is that it's a 3D detection mammographic unit that helps us detect breast cancer much easier than we did before. It has a nice touch interface. It helps us move with the patient, so that way the patient is able to have a little bit more comfortable interaction with the machine. It rotates in multiple different angles, again, to help the patient fit into the machine so that we can image the relevant area of the breast that we need to help detect breast cancer. And the procedure doesn't take long. It takes about 5 or 10 minutes max, and patients are finding that it's very good experiences from what we're hearing from our patients in the community. This machine was really made possible by the generous donations from the people in the community, which really allowed us to bring the machine here. So thank you very much for all of the donations for this machine.
So how does it work? For people who have never had the opportunity to use one of these machines, what happens when a patient comes in here?
So a patient comes in here accompanied by one of our wonderful staff, and the patient, along through the direction and a lot of help with our staff, the breast is imaged on this particular table here. The X-ray source is generated from above, and it's beamed down through the breast, where we then detect the different architecture and potential lesions or areas of concern within the breast. We can move the machine, as I showed, to get different angles from the breast, and this 3D unit actually rotates so that it acquires the breast from multiple different angles. From there, the images get sent to a server, and we can analyze the breast with computers to look to see whether or not there may or may not be an area that we might want to look at a bit closer. Now, one of the advantages of 3D versus the older 2D technology is that patients come to the hospital less often afterwards. There's less need for us to call a patient back, because we know that callbacks, when a woman gets a phone call from the hospital to come back for a second look in their breast, is rather anxiety provoking. So that prevents that second callback, so we get a more complete answer on the first visit.
All right. Well, thank you for explaining this to us today. Thank you for joining us. And thank you, all of you joining us today, and for your generous contributions that really helped get this campaign off the ground and get this machine here in Windsor, Essex for patients. The purchase of this state-of-the-art technology, we have improved our ability to detect and rule out breast cancer for patients in this region. And we could not have reached the goal of $500,000 without the support of our very generous donors. First, thank you to Shoppers Drug Mart. Donations to the 2019 Love You campaign by Shoppers Drug Mart surpassed $64,505. Thank you to everyone in the community who contributed to this campaign, and thank you to Dr. Matthew Tiber, pharmacist owner and peers representative, for his leadership in this campaign. Thank you to Carol Parent. Carol chaired the 2019 Sail into Summer event, which raised more than $39,000. And Carol is looking forward to hosting the next Sail into Summer event in 2021. Thank you to Stephen Kurtz for your generous donation of $15,000. This was given in honor of his daughter. Thank you to the India-Canada Association. Their 2019 annual event raised $8,500 for the 3D digital mammography machine. We are sad to report that shortly after the event, ICA President Purnima Kumar passed away. We will always remember Purnima's kindness and her leadership that brought together her community to support our hospital. Thank you to the Chicharo Club's International Women's Day Committee for your continued support of Windsor Regional Hospital's Breast Health Center. Over the past several years, this group has donated more than $150,000 to support our services through their Fun Fashion Show event. This year's proceeds directly support the 3D digital mammography machine. Thank you to Allison Baldwin for spearheading the initiative Kicking Cancer to the Curb, One Boot at a Time. Allison and her team fundraised all over Amherstburg with their branded rubber boots, raising more than $3,000 for the new 3D digital mammography machine. Thank you, Susan Duxter, a grateful patient and local artist. Susan handmade hundreds of one-of-a-kind pieces of jewelry that were sold in support of the 3D digital mammography machine. Thank you to Harvey and Elaine Snaden, co-chairs of the 2019 Hats On for Healthcare campaign, and everyone who participated by wearing a hat and making a donation. The 2019 event raised more than $50,000 for the 3D digital mammography machine. And thank you to everyone who participated in the inaugural Fantasy 50/50 draw. In support of the 3D digital mammography machine, this jackpot rose to over $92,000. And finally, thank you to members of the Vietnamese Pho Minh Temple. Many members of this organization are immigrants to Windsor, and they wanted to do something to thank the entire community. So, following the sale of their temple, they donated $80,000 to support the purchase of a new 3D digital mammography machine. They recently presented a check to the Windsor Regional Hospital Foundation, marking a significant milestone in this campaign.
On behalf of Windsor Regional Hospital, I want to say thank you very much to the Pho Minh Temple for this very, very generous gift towards the digital mammography machine for Windsor Regional Hospital.
And thanks to this wonderful $80,000 donation, we have surpassed our goal. It has put us over the top, and we're so thankful to the Pho Minh Temple.
And again, I don't think that we can overstate our thanks to everyone who contributed to this campaign. It's a word that we're hearing a lot this morning, but sincerely, thank you to everybody. And now I want to introduce you to Vicky Komar. Vicky is quite familiar with mammograms. She's had several over the years, and she knows very well about the stress and the anxiety that patients can feel when those test results are unclear. Vicky is an active volunteer at Windsor Regional Hospital. She helped support the 50/50 draw that raised money for this machine, and she wanted to be part of today's celebration.
It seems that most of us know someone who has been diagnosed with breast cancer, and 5 years ago, I became someone to my family and friends. Just recently, I had my annual mammogram, and because of COVID-19, the training had not been completed on the 3D machine, so the other machine was used for my test. Not a comfortable experience for most, but worse, post-surgery. I was called the next day to be advised that there was something of concern noted. I went back 2 days later to have a more intense mammogram and ultrasound. The short wait time was wonderful, but extremely stressful as well. Fortunately, I required no further intervention. For all who have utilized the mammography machine as a routine part of our healthcare or to monitor further breast cancer issues, we know how valuable this machine can be. It is exciting to know that the 3D machine is more accurate. The three-dimensional X-ray means there are views from different angles with better images that detect abnormalities more easily. There is also a much lower rate for false positives, which reduces the likelihood that someone will need to come back to the hospital for further tests, as in my case. As well, it's more comfortable due to less compression. And finally, it can help find hidden cancers up to 15 months earlier. On behalf of those who will use this machine in the future, to all of you who have donated financially, thank you.
And thank you, Vicky. When City of Windsor's Poet Laureate, Marianne Mulhern, heard about this campaign, she got creative. Her poem, Science of Hope, draws on the experience of somebody very close to her. And we are fortunate to have her with us today to share that poem as we wrap up today's presentation.
Hi, I'm Marianne Mulhern. I'm Windsor Poet Laureate, and I was asked by Windsor Regional Hospital to write a poem to honor the new 3D mammography machine, which they have now installed and which will save many lives. And the poem is Science of Hope. Kathy, a young mother, fears the darkness hidden in her breast. She held her mother in a long, weary winter. Kathy, too cold for a young memory. Mother. Springtime opened a grave, her mother's name etched in stone. Hope begins with a promise. 3D mammography. a machine programmed to detect, image, identify breast cancer, an ancient enemy illumined in the light. Detection early enough for Kathy to walk into the sunshine of each new day. Every morning a gift for Kathy, her family. 3D mammography, a blessing of science, looking to the stars.
Hello, for those of you who don't know me, I'm Giselle Sagan, the Director of Public Affairs and Communications and Philanthropy for Windsor Regional Hospital. I was really looking forward to having the donors come to the hospital, see the machine. I was picturing champagne glasses, let me tell you. I'm really sorry that things are such that we couldn't invite everyone in today, but I'm absolutely thrilled that we have donors and friends joining us today. So thank you very, very much.
And for those who don't know me, I'm Christina Nacarado, Manager of Philanthropy at Windsor Regional Hospital. Before we close things off this afternoon, we wanted to reiterate our profound thanks to all of you who have contributed to our campaign to bring 3D digital mammography to Windsor and Essex County.
Now, we heard from Dr. Denoa about how amazing this machine is. We're talking to the staff and they're telling us that it's being used even more than anticipated. So we are absolutely thrilled. And again, we want to thank all of the donors who made this possible. And of course, our foundation has other needs. So you're going to be hearing more from us in the future. But thanks for joining us today.
So to keep up to date with our current fundraising efforts, please visit our website at www.wrhfoundation.ca. And on behalf of all of us at Windsor Regional Hospital and Windsor Regional Hospital Foundation, thank you again and have a great afternoon.